Hello, and thank you for coming to this presentation. I'm Chloe from the University of Ottawa's Institute of Mental Health Research at the Royal. This presentation will be looking at a literature review that assesses the trajectories and outcomes of ethnoracial individuals within the forensic mental health system. We will begin by discussing the background and purpose of the study, followed by the research question and objectives. We will then discuss the methods used and the results found within Canadian and international settings. Finally, we will discuss the practical implications of our findings and the limitations and areas for future research. To provide some context, we know that racialized persons and those born outside of Canada are at elevated risk for developing serious forms of mental illness and are overrepresented in forensic and criminal justice mental health settings. Factors related to race and ethnicity, primary language spoken, level of English proficiency, country of birth, and immigration status might affect one's ability to navigate the forensic and criminal justice systems optimally and efficiently. These effects can ultimately lead to ineffective, inefficient, or inequitable outcomes in care. As such, the purpose of this literature review was to synthesize available research literature regarding the trajectories and outcomes of Black, Indigenous, and people of color individuals in forensic mental health and criminal justice settings to inform the design and delivery of services in the province of Ontario that are effective, efficient, and equitable. We wanted to assess how race and ethnicity, language fluency, country of birth, and immigration status are related to hospital trajectories, rates of rehospitalization, and criminal justice outcomes for persons found NCRMD or equivalent. Our objectives were to review existing literature on trajectories, outcomes, and gaps in services in the forensic mental health system, and to assess the effectiveness of current practices. A search strategy was developed in March 2023 and included studies conducted within Canada that would directly speak to the Canadian forensic mental health system and the NCRMD regime specifically, as well as relevant studies from the international literature. Trajectories were generally defined by the length of time taken to reach each major milestone in forensic mental health care, and factors impacting forward-moving trajectories, including restrictions of liberty, moves from lower to higher levels of security, types of dispositions, and rates of inpatient violence. Outcomes included rehospitalization and criminal recidivism. The search strategy resulted in 634 documents. After duplicates were removed and studies were screened, 87 documents underwent a full text review to organize all documents into specific categories by topic area. This resulted in 56 documents that were retained for this literature review that underwent data extraction using covenants. A narrative synthesis of the included documents was subsequently completed using a convergent synthesis design. In terms of trajectories in Canada, the results demonstrated a disproportionate representation of ethno-racial minorities in the Ontario and Canadian forensic mental health system and longer detainment of ethno-racial minorities in the Alberta forensic mental health system. There is also a disproportionate representation of Indigenous individuals in the forensic mental health system, but they are less likely to be found NCRMD or NGI. Indigenous individuals found NCRMD took longer to receive a discharge from the Ontario Review Board compared to non-Indigenous counterparts. Mental health differences between migrant and Canadian-born groups was also found. As migrant groups typically exhibited a later onset of mental health symptoms, age at first hospitalization, and were more likely to be diagnosed solely with a psychotic disorder, whereas Canadian-born individuals were often diagnosed with co-occurring psychotic, substance use, and/or personality disorders. Additionally, migrants and other ethno-racial minority groups faced increased risks of receiving psychiatric or substance use treatment orders, as well as committing self-harm. Finally, migrant individuals experienced language and communication barriers despite speaking English, which impacted their understanding of rights and decision outcomes, and felt the Consent and Capacity Board failed to accommodate cultural and religious needs, leading to reported experiences of racism and difficulties accessing social supports. In terms of trajectories outside of Canada, there was a disproportionate representation of ethno-racial minorities and migrants in the forensic mental health system and psychiatric hospitals. Additionally, there was a disproportionate representation of BIPOC individuals encountering justice involvement and receiving certain judicial outcomes. This included a greater likelihood of encountering justice involvement rather than receiving psychiatric hospital care, placement in high-security hospitals, the requirement to undergo court-ordered competency evaluations and subsequent findings of being incompetent to stand trial, higher frequency of being assessed for criminal responsibility and greater likelihood of being found criminally responsible, and evaluators being less likely to recommend a not guilty by reason of insanity defense for minority defendants. Finally, demographic factors impacted individual trajectories in the forensic mental health system. In the United Kingdom, key predictors of successful mental health court completion included education, length of program stay, and whether or not the participant was Black. And in Germany, migrant patients were discharged from forensic psychiatric care more quickly than their non-migrant counterparts. Regarding the outcomes of BIPOC individuals in the forensic mental health system, there is a noticeable gap in research specifically addressing outcomes for ethno-racial groups within Canadian forensic mental health systems and the criminal justice system. Outside of Canada, the effectiveness of mental health interventions may vary by race, as there were no significant differences in recidivism rates between Black individuals who received mental health services and those who did not, whereas white participants who received similar services exhibited higher recidivism rates. Reconviction varied by study, with some finding higher reconviction rates among Indigenous individuals, Black individuals, and white individuals. There are several key takeaways from this review. Regarding the trajectories of ethno-racial groups, the studies reviewed suggest that there is a growing representation of non-white individuals in the forensic mental health system and a decline in Canadian and European-born individuals over the same period, with findings collectively suggesting that certain ethno-racial groups may face disproportionately longer stays in the forensic mental health system, raising concerns about the efficacy of care and treatment within this setting. The overrepresentation of Indigenous individuals in the Canadian forensic mental health system is especially notable, with these individuals also facing markedly less favorable outcomes in terms of discharges, which raises questions regarding the cultural, historical, and social factors that may contribute to their overrepresentation and unequal treatment. Additionally, the experiences of migrant and minority groups in the forensic mental health system and criminal justice system regarding mental health symptoms and treatment, cultural and language barriers, overrepresentation, and judicial outcomes highlights the challenges faced by these individuals and need for more targeted interventions to address the systemic and structural issues leading to disparities in forensic mental health and criminal justice systems worldwide. Regarding the outcomes of ethno-racial groups, there is a noticeable gap in research specifically addressing outcomes for ethno-racial groups within the Canadian forensic mental health system and criminal justice system. Also, there were no significant differences in recidivism rates between Black individuals who received mental health services and those who did not, whereas white participants who received similar services exhibited higher recidivism rates. Finally, justice involvement varied across ethnic groups, with studies indicating that Black and white individuals, as well as Indigenous individuals, experience differing levels of justice system engagement. This suggests that certain socioeconomic and systemic factors, such as homelessness and untreated mental health disorders, may lead to higher justice involvement in certain ethnic groups. 5 key limitations have been identified. First, the geographic distribution of studies influence the findings, as laws and policies differ across countries. Therefore, conclusions may not be universally applicable. Secondly, many studies generalized racial and ethnic groups, often comparing BIPOC individuals as a whole against white individuals, which overlooks significant within-group differences and variations. Thirdly, the interconnected nature of the forensic mental health system and criminal justice system means findings from one system may not directly apply to the other. Fourth, studies often use different definitions and measures for key variables, such as trajectories and outcomes, which impacts the interpretation of the results. Finally, many studies did not account for relevant confounds when assessing the impact of race and ethnicity. Future research should seek to assess interprovincial differences within the Canadian forensic mental health system to ensure the findings are accurate and generalizable across the country. Future research should also seek to utilize perspective and longitudinal approaches that track individuals over time to better understand how their trajectories and outcomes evolve within the system, as well as qualitative methodologies to explore the lived experiences of people of color with mental health disorders. Finally, future research should seek to examine cross-cultural biases and treatment inequities to identify and eliminate discriminatory practices and barriers faced by minority groups to facilitate more equitable mental health care. Thank you for watching this presentation. We also want to express our gratitude to the Ministry of Health for funding this project. If you have any questions about the study, please feel free to reach out to the authors at the emails listed.